Google Analytics fails HIPAA for US healthcare. Every healthcare website wants to track visitors, optimize campaigns, and measure outcomes. And Google Analytics seems like the obvious choice. But here is the problem. If you are handling patient information in the US, using Google Analytics can actually put you in violation of HIPAA regulations. Sounds scary? It is. One wrong click and you could expose protected health information or PHI without even realizing it. In this video, I will break down why this happens and what you can do instead. Hi, I am Mehul Brahmbhatt, CEO and founder of Matrix Speaks. Over the past 15 years, I have helped healthcare organizations and handled sensitive data safety while building a digital tools and analytics systems that actually comply with regulations. And today we are talking about a tool almost every website uses, Google Analytics, and why it fails when it comes to HIPAA. I have worked with the hospitals, clinics, and health tech companies, and I have seen firsthand how digital analytics can become a compliance risk. But the good news, once you understand the problem, it's actually pretty straightforward to fix. And here is the critical part. Even small mistake in how you track data can turn into major HIPAA violations. Let's break down exactly what makes Google Analytics risky for healthcare website. HIPAA basics for analytics. HIPAA exists to protect PHI, protected health information. Anything that can identify a patient falls under this, including names, address, date of birth, medical record number, and even IP addresses in some cases. When you are running analytics on a healthcare website or a patient portal, you are not just tracking anonymous user. You might inadvertently be sending PHI to third-party tools. If that tool doesn't have a signed business associate agreement (BAA) with your organization, it's a compliance violation. Key points: PHI includes direct identifiers and anything that can be tracked back to patient. Third-party tools must sign a BAA if they touch PHI. Even seemingly anonymous data can become identifiable when combined with other information. Why Google Analytics fail HIPAA? Google Analytics is widely used because it's free, powerful, and easy to implement. But for US healthcare, it becomes the serious limitations. By default, GA collects IP addresses, device information, and session data. Send this data to a Google server outside your organization. Does not provide a HIPAA-compliant BAA for its standard analytics services. Even if you anonymize IP addresses, GA can still capture user behavior that, when combined with other internal data, could reveal patient identities. Let's say a patient logs into a portal to view lab results. Their session might include appointment IDs, search queries, or a page visits. If GA tracks this session, PHI is leaving your secure system, and without a BAA, that's a violation. Common misconception. Many healthcare teams make assumptions that put them at risk. Anonymizing IP is enough. IP is just one identifier. Other session data can still link back to patients. We don't collect names, so we are safe. Even without names, metadata, IDs, and page interactions may reveal identities. We only use GA for marketing, not patients. HIPAA doesn't care about intent. It cares about any PHI exposure. The reality is, GA was never designed with HIPAA in mind. Treating it as safe for PHI is a gamble you don't want to take. Safe alternatives and best practices. The good news, there are ways to get analytics insight without violating HIPAA. Options include HIPAA-compliant analytics tool, platform like Matomo on-premises or Piwik Pro with a BAA allows you to track website usage safely. Segregate PHI from analytics data. Never send patient identifier to a third-party tools. Use anonymized metrics or aggregate reporting. Business associate agreements. If any third-party tool touches PHI, make sure there is a signed BAA to cover liability. Internal tracking. Consider logging key analytics within your own secure server to maintain full control over PHI. By combining these steps, you can still measure engagement, optimize campaigns, and improve patient experience without risking compliance. Key takeaways: Google Analytics is a fantastic tool, but for US healthcare organizations handling PHI, it can create serious compliance risk. If your healthcare website handles PHI, sending that data to GA is a serious risk. Instead, focus on a HIPAA-compliant platforms, anonymization, and agreements that protect your organization and your patients. Following these steps ensures you get insights safely while staying fully compliant. If you are unsure about your current setup or need guidance on building a fully compliant analytics system, that's exactly what we help healthcare organizations do at Matrix. Our team can assess your workflows, implement safe alternatives, and make sure your digital analytics actually work without putting patient data at risk. Thank you for watching. If you found this video useful, make sure to hit that like button, share it with your team, and subscribe for more insights. I'll see you in my next video.